Okay. I think we're live, so let's start. Hi, I'm Katerina. I'm the SCOME director, and welcome to the Advocacy in Medical Education webinar. This is the fourth SCOME webinar. We're trying to have at least one per month, and we're trying not to only involve the IT in the preparations, but also some cool nomies that can share exactly what they're doing on a national level, and that impacts the local level as well. So starting the introductions, ladies first. Lina, do you want to introduce yourself?
Hi, everyone. My name is Lina Hassanin. I'm the NOMI from IFMSA Egypt, and I'm here to talk about one national advocacy project that we have in Egypt.
Okay. Then we go from Egypt to Colombia. Danielle?
Hello, everyone. My name is Daniel Ardila. I'm the NOMI from Asmicol, Colombia, and I'm here to share some experience in advocacy in Colombia. I hope you enjoy it.
Last but not least, we have our general assistant.
Hello, everyone. This is Marwan, or you can call me Maru. I'm the SCOME General Assistant, as Katerina said, and I'm really happy to be alongside with my friends on this webinar, so we can share with you one of the topics that members requested on our social media post, which was about advocacy in medical education, and I hope you would enjoy it.
Okay. Thank you for everyone for introducing yourselves. And now I'm going to try to share the PowerPoint without making a mess. Okay, just a second. Present. Presentation mode. Screen share. I'm not sure how to work on this, so give me a second. Manu, can you help me? I am the only one who can share the screen?
I think no, you can't help. I can do it as well from my side, but you have to select my screen.
I selected yours.
Wait, let me try. I'm on my cell phone. No, it's not working from my cell phone.
Okay. Maybe I'll just go ahead and talk. And
yeah,
once I'm finished talking, I will put on the slides, I think. Maybe that's the best part. You will not witness my perfect expertise, or actually none at all, on making slides. But basically, what I wanted to talk is about introducing the topic. As Maru said, and this is very important, it was requested by the members in our Facebook group. And I think it goes to the point of asking what is students' role when we're talking about medical education, and what can we do? And do we have an active role, or are we just going there for 4 years or 6 years learning stuff? What do we do in our medical schools? And I think, and this is on the SCOME mission and vision, that our role goes beyond just enjoying the education, but also contributing to her, to the education, and being part of our education. I think ultimately we would like to see ourselves as partners with our teachers, and having conversations with them, and trying to discuss our education and how we learn better, so that after all we become better doctors by the feedback that students have, by the feedback that teachers have. When we were talking about this, and I think that when we talk about students' representation and engagement in medical school, I always go back to the AMI Aspire, which is an award that AMI, the International Medical Education Association, gives out to the medical schools that are excellent in a field. And the reason why I bring up this is not because of the prize itself, it's because of the criteria they have for excellence in student engagement. If the Medical Education Association says that there's such thing as an area of student engagement that could be excellent, maybe that's something that we should be working on. And they give us like 4 main areas to work on, which is management. Are you involved in the or are you as a student, not you necessarily, that's watching this webinar, are you as a student involved in the management bodies, the ones that decide the exam calendar, that work with the teachers to have a better evaluation, that end out the questionnaires at the end of the semester to see if the goals of the course are met, if the students are pleased with what they've learned so far. Those structures that we have in our medical schools, sometimes with not only teachers, but also administrative services. So there's a lot of bodies, and they will depend on each country and each medical school. But it is a criteria if students are involved in this organizational part. But not only that, this is only the first one. The second area is, are students involved in teaching and assessment methods? And this can be very bureaucratical, and you think of it from the perspective of, okay, so we don't really have an influence in going to a meeting with teachers and decide. But what about the power that you have when you maybe at the end of a lecture approach the teacher and say, well, I liked the way that you did the lecture today because this and this and this. And you just build on this conversation with your teacher, and you go one by one, and maybe you will make a change in that course or in that year, and maybe in the whole school in the way they do things. Progress doesn't mean that we need to change the whole curriculum. Changing the whole curriculum, it's feasible, but might be a bit hard at first. But if we start small and with little changes, maybe an evaluation, and the teacher is worried because everyone or most of the class didn't succeed as much as he thought he would, and he asks some people for a meeting. Go there and express your opinion. That's part of what we can do to improve our education. If we feel like an evaluation wasn't as good, or didn't really evaluate what we learned, the competencies that we have, why don't we propose a better way to do it? So there's a lot of ways, and I just poured you in a lot of information. But basically, it all comes down to, are we engaged in the teaching and assessment? And how can we do this? So I told you, in the management, teaching and assessment, and then in research and academic opportunities. Do we have access to research as students? Are we able to propose research topics? Is this something where the academia part of the university is encouraging or not? Maybe we can approach an investigator and say, why don't you have an intern every year so they can help you? And we start to engage more and more. An excellent example of that is what we do in the SCORE exchange, which we involve students in the research departments. So why don't we do that not only for exchanges, but also for the local students? That's one. And the final one, it is about the local community. And we talk about social accountability a lot in SCOME. And we talk about how students should have a role not only in the medical school, but beyond the medical school, in the community. So those are the 4 criteria that this prize proposes, that you can look for it and elaborate a bit more. But I think this gives you a good idea of what can be the student's role in medical education. Sometimes we think that it is only when we have a seat in that specific committee that we can make a change. But I hope that by hearing this quick brainstorming, you thought of other alternatives and a lot of different ways where you could actually make a change. And I think that when we hear Lina's and Daniel's experience, you will also have other ideas. So I talked about how can students be involved in medical education. And now let's go to the part of advocacy. So we usually talk about advocacy of actions that we implement to affect change on something. And in a way, we talk about advocacy and our mind goes into two ways. Or at least mine goes. I don't know about yours. So you can go with thinking of advocacy and you think of all those external meetings and a lot of what goes on in IFMSA with the liaison officers going to very important meetings at a medical education level, going to meetings with the dean and trying to advocate for certain things to be included in the curriculum. And that's part of it. That's through a representation structure and through governance bodies. But we can have a whole different perspective, which is the advocacy that starts with activism. And mostly when we're talking to our local committees and we say, okay, so we don't have enough suture skills in our curriculum. And one way could be to go to the dean and say, hey, we don't have enough suture skills in our curriculum. But what we see in SCOME a lot is that, okay, let's take it upon ourselves and complement the curriculum by the activity that we do. And this is a form of advocating because then we can build on the research on or do an impact assessment, say, see, people are applying for this. This is interesting. And it's another form of advocating for something is taking it upon yourself. And we talk about activism, of doing something proactively to effect a change. And we're doing that. We're improving suture skills, but not by the usual structure. We go around it, and maybe someday we will go to the dean with that data that we collected, saying, this is actually impactful. Don't you want to add in your curriculum? Maybe that could be a way. There's a lot of ways to advocate in medical education. I just gave you a couple of ideas. It can go to, we see this lack of practical skills in the curriculum, so we implement that. We can look at the organization, as simple as we have two tough exams in 1 week, and then in the next week, we have two very easy exams. Why don't we suggest to change one of the tough by one of the easy ones, so we have more time to study hard for the tough exams? Organization, as we know from our experience as medical students, sometimes goes a big deal into improving our learning. So this can be a way. And there's a lot of ways that you can improve. There's a lot of articles that you can use to see what can you improve in your medical education. At the end, Maru will tell us about the resources that SCOME is creating. But another thing is that you can also look in the SCOME public folder that was just shared the other day. And it's shared on the Facebook group and through our email server. And you will have articles from experts on what can be changed in the curriculum. How do you evaluate curriculum? And that can also help you. I think for me, that's it. I would now go to Lina to tell you a bit more practical examples of how to work in advocacy in medical education.
So hi everyone, I'm back again. This is Lina, the Nomi from IFMSA Egypt. Today I'm going to be talking about towards better medical education, and that is a project that we have in IFMSA Egypt. It's the core SCOME project. since we're talking advocacy, I'm going to go back to the start. In 2017, 2015, we had a national initiative to show, through a survey, to showcase the levels of satisfaction among Egyptian medical students with the current system, where we collected data from all the university medical schools in Egypt. And then the data was presented to the Supreme Council of Universities, which is the main governmental sector responsible for medical education in Egypt. These results actually contributed to the adoption of a new medical education system in Egypt that moves from the classic system to the integrated system. And this new system is being implemented starting from this year. So like the new system, students are in the first year now. But we still needed to make sure that this reform continues and that the students are still actually involved, which is the aim of our project. So how do we do that? We have two parts of the project: capacity building, which I discussed before, and students' involvement in the medical education. For the capacity building part, we do national training camps with representatives from each LC, where afterwards they go back to their LCs and universities and conduct medical education sessions and so on. But then the advocacy part, which is the important part, we do that on two levels. Nationally, from me as a national officer with the national team and the national coordinator of the project, and locally by each local officer. Nationally, we are still maintaining communication with the Supreme Council of University, which is our council, our main partner in this case. We keep them updated with the students' opinion, and we propose recommendations to them whenever it's possible. How do we do that? Usually it's through meetings, emails, newsletters, you name it. And then on the local level, we have the LOMIs approaching either the local quality assurance unit or medical education unit to involve them in any decision-making process. And this, of course, they support the university because right now there is an ongoing, let's say, capacity building for all the medical staff, all the teaching staff in medical schools in Egypt. So basically we handle the students part and we support when it comes to the teacher part. But then we have the main platform, of course, that gathers all of this together nationally and locally, governmental and non-governmental, from all the students from the national and the local and everything. And that is our Medical Education Forum. This year it's going to take place at the end of July. Basically, the forum is a bunch of panels from the government and students and non-governmental organizations that work on medical education, where we share and discuss the ideas. And our main focus this time is going to be the new system, how evaluating it, and how can students still remain involved in it in the years to come. We're, let's say, still miles away from our goal, which is official recognition. Up until now, we're still observers. We provide recommendations, but it's still not 100% official. There are many examples from other animals of like the official recognition thing. And this is our goal, but we're on our way there. So this is pretty much it. Moral of the story: you need data, present it to whoever is responsible, and they will listen to you. You just need to try. That's it. That's pretty much it for me.
Okay, so hello everyone. As I was saying, I am Daniel Ardila. I'm the name from ASIMCOL. For those who doesn't know where ASIMCOL is, it is in Colombia, South America, and I'm here to talk to you about my experience and our experience in ASIMCOL about advocacy. So, next one, please. So in ASIMCOL, we have been working this term in a project called Hands in Action. So we aim, it is based in the Sustainable Development Goals, specifically the number 10, the reduce inequalities. And we hope to be working with the agenda to 2030, where it aims to empower the deaf community. Well, in this case specifically, is the deaf community. So we work with that. We have been working with the National Deaf Institute as our partnership. They are like a small part of the Ministry of Education in Colombia, and we have been working also with the private sector of the deaf community, which is the FENASCOL. It is a federation for deaf people. So the project basically aims to, this is the logo, the official logo of the campaign, and we have several activities. So the first one was to modify our website in order to make it user friendly. So if a deaf person would like to come and see what we have to offer in our website, they can have the translation to deaf to sign language. So it was like a really nice cool to do. They were really interested of working with us, but unfortunately we have to change our website, so we lost our work, but we're working on it again. And the second one and the big goal of this activity is to change the curriculum in Colombia. So ASEMCOL basically counts with 38 say local associations. So what we want to achieve in a future is to change our medical curriculum in order to have sign language in all medical university, well, at least in those who we are present, like the 38 along all Colombia. And the images you can see up there is the directive council of ASEMCOL. It was really nice. Um, there was a deaf people, a deaf person, sorry, and another one who was translating him, and they taught us some sign language, some basics, and how to deal with a patient who's deaf, how we can make them accessible to the health they all deserve as human beings. And the other images you are seeing up there, it is me presenting the activity in the regional meeting. um, it, it was really nice to present the activity to show other members of the region what we have been working on, because no one has ever been interested in medical education in Colombia. And the deaf community is a huge part of ASEMCOL's and Colombia's richness, and we have to work for them. So next one, please. And the other objective of the activity was to work doing some images like this one, because we don't have a clue of what is the deaf community. So we wanted to bring this information to you. As you can see, well, we did another one in English for you, but they are all in Spanish, as is our official language. And basically is this activity to to share what it means to be part of a community, in specifically the deaf community. What is sign language? What are the bad words that you can say to refer to this community? Like in Colombia, we have a word that is called sordomudo. It is like deaf mute, and it is offensive to them, and we don't know that, and we use it all the time. So, and the other one is to teach the doctors how they can treat a patient with this disability, like what to tell them. If you don't know sign language, it's okay. Colombia has some resources, but you have to know what they are. But we are never taught that in medical school. So we're basically advocating for the deaf community in medical education, and that's a bit of our experience in this topic. If you want more information, I'll be happy to share it. Thank you. That's all for me.
Thank you,
Thank you.
Danielle.
Go ahead, Maru.
Yeah. So, as you have seen some examples of medical education advocacy in some different NMOs through IFMSA, we need now to see what does IFMSA do so it would empower all its members so they can be medical education advocates. As Katerina has mentioned earlier, SCOME is a platform that envisions that medical students all should be involved and actively participating in the development of their own education. And one of the tools that IFMSA reaches this and reaches this vision is IFMSA programs. Can we go to the next slide? Yes. So, as you know, like IFMSA programs are a structure that streamlines all the activities of IFMSA, whether they are implemented on a local or national or even an international level. And one of these types of these activities are the advocacy efforts that medical students do within their medical education systems. So the IFMSA programs framework does enable members of IFMSA from the different NMOs not only to develop advocacy plans, but also to monitor and follow up on them through the framework of the IFMSA programs. And this has been enabled through the closely follow-up from the support from the program coordinator. So if any of you is interested in developing advocacy plans and or you would need more to brush up your advocacy efforts, and you would need, for example, feedback as well to your advocacy results, you can contact the program coordinators that are relevant to your advocacy work, and they would be supporting you not only with steps from scratch so you can develop your advocacy plan, but they would help you in assuring the quality of your work within your medical education system. And advocacy efforts could be developed in so many different focus areas. As you can see in this next slide, there are different focus areas and as we took the example of medical education systems program, which is more concerned about the advocacy efforts of medical students within the medical education system. And there is a more detailed document that IFMSA produced detailing what types of activities could be implemented within the light of these focus areas. For example, assessing social accountability of our medical school, or as Katerina said, advocating for developing our curricula from the extra or non-formal, the extracurricular or non-formal education activities that we do in SCOME. For example, if we have the example of SCOME Colombia, that they were developing their curricula starting from their non-formal education activity of teaching sign language for medical students. And this is something that you can do not only for this topic, but for other topics or areas or fields that you think are missing within the medical curriculum in your university or in your national medical education system. Yes, so there are different focus areas and they are very diverse, and you can work on them within your medical education system. So do not hesitate to check out and consult the document of IFMSA programs focus areas document that is available on the IFMSA website, and it details all the advocacy efforts as well as the other activities that you can do within this program. Can we go to the next slide, please? Yes, so as we have seen earlier, not only IFMSA enables the development of advocacy activities, but we can also have some research activities, and they can go simultaneously with your advocacy efforts, because you need to strengthen your claim and to empower your advocacy efforts with some evidence-based results through comparative studies, as well as the program's annual report that highlights the impact that IFMSA creates through the activities that we do. For example, if you are advocating for developing your curriculum through adding or changing the whether it comes to new teaching or new assessment methods, you can consult the program's annual report through more specifically to the program that you are working on and the focus area that interests your advocacy effort. And you can therefore look if IFMSA has worked on an international level through this same focus area and what is the impact that it has created. As you can see through this slide, this is a part of the program annual report for teaching medical skills in 2017. And it mentions, for example, the impact that IFMSA creates through the competency-based workshops and training. And you would see, for example, how many medical students they have impacted, and what was the result of that impact they have created. And these results can be added to your advocacy efforts and to your advocacy plan, and it would strengthen your claim within your medical university. Can we go to the next slide? Cool. So, has to be able to develop these advocacy plan. IFMSA also has another tools, which are, first of all, the training medical education workshops, which is the TMATS workshop are a capacity building tool of IFMSA that enables you not only to acquire some medical education knowledge, but also to develop some advocacy skills, and most importantly, to be able to spread that medical education knowledge and spread these advocacy skills among medical students, so you can recruit more medical students to your cause or to your advocacy plans, and then make sure that all medical students of your school or your national medical education system are aware of what you are working on and what you are advocating for. Can we go to the next, please? Not only TMAT, but also we have another workshop that SCOME has developed, which is the AMET, or the Advocacy in Medical Education Training. It is a different workshop from the TMAT, as it enables also to acquire some medical education knowledge, but also to develop an advocacy plan by the end of that workshop. So it would help you have an outcome directly after that workshop and implement it directly within your medical school or on a national scale within your medical education system. So can we go to the next slide, please? Next. Yes. So there is, if you consult the document for the AMET framework, you would notice the different topics that could be addressed within this workshop, and they interest more all the focus areas and all the topics and all the fields within the medical education systems where you can advocate for changes and implement advocacy efforts. For example, whether you are more working in the quality assurance and accreditation council within your university, or you are more oriented to work in curriculum development, or when it comes to developing national policies on medical education, you can have these topics addressed within the AMET framework. And as within the AMET agenda. And now animals are able to host the AMET workshop within SRTs according to the capacity building regulations of SCOME. So if you want to develop an agenda, make sure to consult all the topics that are enlisted within the AMET framework, and make sure to tailor them to your advocacy plan, so you can learn as much as you want and implement all that knowledge in your advocacy plan. Can we go to the next slide? And last but not least, the SCOME International team is now working on a toolkit about advocacy in medical curriculum. It's a toolkit that aims to introduce you to the to structuring your advocacy initiative, so you can have a more oriented and a more structured advocacy efforts within your directed to your medical curricula, as well as it has annexed a medical curriculum assessment tool, so you can assess your medical curriculum and see how much, for example, a topic is addressed within your medical curriculum, as well as you can see through this toolkit different you can see information about different good practices of advocacy initiatives. So I believe that's it, and we would like to hear from you as well, your advocacy stories and experiences that you have either conducted or participated in within your medical education system, and we would be happy to hear them on the chat below us. And if you have any other questions, please do not hesitate to ask. Do we have questions? So
I think we don't have questions so far. Yep. I think we don't have questions so far. Maybe I'll just thank everyone for whoever attended or will watch later on that was here with us. Also, thank you to Danielle and Lina. Lina had to leave, but thank you to both of you for sharing your experience. And thank you, Maru, for organizing our webinar. And I hope that you enjoyed this one, and next ones, not only you will view it, but possibly even have a few questions for us or a few more interaction. I think that's it for us. Do you want to say something else, either Maru or Danielle?
No, thank you for the invitation, and thank you all for paying attention. Thank you, and we hope you'll make excellent medical education works.
thank you, Danielle. I just want to remind that possibly we're going to share this webinar on our servers as well as our Facebook group, and you can still share with us your medical education stories there as well, and we would be happy to hear them and maybe promote them more if you'd like to.
So I think we say goodbye, but please comment when we share over the platforms if you have successful stories, because we could even include one of your successful stories in our Advocacy and Medical Curriculum Toolkit, which will be out very, very soon. And in the meantime, bye everyone. I hope you had a good time.